So I'm Marie Brault. I'm a medical anthropologist and an assistant professor here at UT Health in the San Antonio campus in the Department of Health Promotion and Behavioral Sciences. And a little bit about me and the work that I do. As many of us do, I kind of wear multiple hats in my research. One is kind of my subject matter expertise around adolescent and young adult sexual, reproductive, and mental health. And then the other is more of a methodological hat around qualitative and mixed methodologies. Very interested in kind of innovating in methods and applying those to problems like implementation research. And through that hat, I've worked on a range of health issues kind of all over the place. Currently, I'm working on projects in the US, India, and East Africa, and I've also worked in Southern Africa as well. So that, can I go ahead and get started, Suja?
Yes, please do. Thank you.
Great. So I've organized the session around some key questions. So first, kind of getting the terminology down. What are participatory and community engaged approaches? Then providing some examples of participatory or engaged frameworks, theories, and methods that can be used. And then finally getting into the implementation science piece of it. Why and how should we use these for implementation research? Provide some examples, primarily from low and middle income countries, and wrap up with some conclusions, some key take-home messages, and starter set of resources and references to help support your community engagement work. So before we get started, I just wanted to take a quick check and see how many of you have used participatory or community engaged approaches in your work. Not necessarily in implementation research, just community engagement and anything that you've done before. So I'll give you a chance to respond to that.
Dr. Brault, I'm not sure if it's just me, but we're having a little bit of trouble with your audio. I just was wondering, whilst they answer that, if you wanted to adjust your mic or anything.
Let me see if the headset helps. I had some problems with my headset yesterday, which is why I did not use it.
Okay. If it doesn't work,
I'll try to talk louder. Does that do anything?
Maybe you're more close to your microphone. A little bit broken here as well.
Okay. Is that better at all? No.
It's similar. We can manage. It's not terrible, but it's just a little in and out.
Let me just try this real quick. See if this does anything. Is this better?
I think it will. I think that's better. Yeah.
Okay, great. All right. So hopefully everybody had a chance to answer the poll question. CJ, can we see the results? Great. Okay. So it looks like a lot of folks have used some of these approaches before in the past. And then others are still kind of wrapping their head around it. So we've got a good range of experience, which is really nice. Okay, so I want to start off by defining some of the key terminology. So community engaged research, this refers to research carried out with or by community members rather than research carried out to, about, or for them. And this is kind of a general umbrella term that encompasses a lot of different approaches, theories, and frameworks. And depending on the setting or context, community engaged research is also referred to as patient engaged, patient oriented, public involvement, engaged research, or consumer and public involvement. So lots of different terms that all kind of mean something similar. Community-based participatory research, or CBPR, is research in which researchers and community members partner to design, implement, and disseminate research with the primary goal of using research to affect change at the community or at the system level. This is often an iterative approach and really requires kind of sustained engagement. And so this is a framework that can be used to guide community engagement. And then participatory methods are the tools that we use to engage stakeholders or community members. These consist of data collection activities and analysis tools that are carried out by non-researchers or with kind of minimal prompting by researchers. And it's really, the goal is to give community members or the public kind of a voice in problems and decisions relevant to their lives. So it's helpful to kind of understand a little bit about what these approaches are and what they're not. Participatory approaches, it's really an orientation to science requiring partnership between communities and researchers. I do want to note that it is not specific to communities or community partners. Your partners may be organizations, they may be clinicians, they may be leadership at different levels of the system. So I kind of use community or stakeholders or users, those terms interchangeably, but it can really apply to a wide variety of different types of people. Participatory and engaged approaches, they're an effort to address health inequities, decolonize research and practice by centering the needs of the community, not the needs or wants of the researcher. And so really, a lot of this should be driven by others. It's not all about what the researcher thinks is interesting. These are participatory approaches should be collaborative and team-oriented, not siloed or individual-oriented. They generally work better when they're sustained over a period of time, rather than being kind of one-time or superficial events. Simply, talking to stakeholders or community members at one point in time at the beginning of the project, that's not really true engagement. And these approaches work best when they're intentionally embedded into your study protocol right from the very beginning. They tend not to work as well when they're unplanned. So now I'm going to talk about some examples of frameworks and methods that can be used. So I mentioned CBPR just a minute ago. Another framework or approach for engagement is called participatory action research, or PAR. And PAR is a systematic data gathering process involving those affected by a problem in a collaborative effort to design and conduct the research that then gets translated into action to address the root causes of the problem. And PAR, it really is kind of like, it's a way to engage people in designing an intervention or an implementation study, but it also can act as kind of an intervention for those who participate in and of itself, because it really works to build the collective efficacy of the community members engaged in this work. And that's kind of what differentiates it a little bit from CBPR. But both of these frameworks provide processes for conducting community-engaged research, where community members are engaged in all aspects, from kind of developing the research question, the area of concern, the protocols for the project, implementing the research, and then disseminating findings and translating those findings to solutions. And when I say disseminating the findings, I mean not just through scientific peer-reviewed publications, but also in formats that will be presented to people at different levels of the system, and can be translated and useful to lots of different types of people, not just the scientific community. Both of these approaches emphasize co-learning and empowering communities. The figure on the bottom there comes from a book called Ethnography in Action. And this kind of shows the iterative process of a lot of community engaged work. They describe it as a process of observe, reflect, plan, and act. And kind of along the way, you're building allies, you're building partnerships, you're building evidence around whatever the issue or goal is. And over time, as you kind of iterate on this, hopefully you'll create some change. Both of these approaches emphasize physical, mental, and social well-being as key outcomes, and an ecological or kind of multi-level determinants of health approach. So another kind of set of frameworks or approaches to engagement are patient-centered or user-centered research. And these are community-engaged approaches emphasizing study design and methods from the perspectives of the patients or kind of the end users of whatever the intervention or the evidence-based practice is. And you partner with patients, caregivers, and other users to develop the research questions, maybe strategize on recruitment, and really just try to ensure that the end result of the research of the study is useful for those users. And there's a lot of emphasis on co-creation or co-design of the intervention in these approaches. And here again, it's not just for patients, not just for community members. The users might be clinicians or service providers. So now I'm going to talk a little bit about some of the tools that can be used to foster engagement with the community or with participants. So a popular approach, and one that probably many of you have heard of, is photo voice or other visual participatory methods. And these allow individuals to create visual records of their community or their organization's strengths and challenges. And this can be done using lots of different types of media, photography, film, drawing, theater, really just anything that's kind of visual and that is created by the stakeholders, by the community members. And this is a really helpful way to initiate discussion and dialogue around what needs to be done or how to do something. It can also be a very effective way. Visuals are, kind of very powerful way to reach people. And another helpful element of these visual participatory approaches are that they can be used by they're very accessible, and they can be used by lots of different communities, including those with disabilities or other challenges that might make participation or engagement in other forms of research more difficult. Another way to engage community members is through participatory process mapping and systems dynamics modeling. In participatory process mapping, you involve a range of people from across the pathway, and you're trying to put together a picture of what the pathway is, where it works well, and places it doesn't work. And I'm sorry, I know that picture is a little bit blurry. This comes from a recent paper just out this year, where they wanted to map the process when an adolescent has a mental health concern. Where do they go for help, or who do they reach out to, and kind of what are the steps that they take to engage with somebody around their mental health issue. So you can see some of the icons there. Do they call somebody on the phone? Do they go to peers or friends? Do they go to a health center, a religious institution? And so you're really kind of trying to map out from start to finish how somebody moves through this pathway. It can also be very helpful. It's been used a lot for mapping pathways of care, how a patient goes from an initial appointment to diagnosis to treatment or surgery or something like that. Participatory systems dynamics modeling is similar, but it's kind of on a larger scale, as it usually entails multiple processes and systems interacting with each other. This is a systems dynamic model from a paper from 2017 mapping patients' movements through the HIV care cascade in a city in the United States. And systems dynamics modeling, the goal is to engage stakeholders in a process of systems examination and critique and build their capacity as a coalition to address problems in the system that impact the health of the community. You use group processes and group discussion, brainstorming, like Maria talked about, to build visual and computational models that can illustrate factors that affect the structural and dynamic properties of the system. And so then you can, once you kind of built out this system with your partners, you can actually, there's computer programs that you can use for this. You can hypothesize how making changes, how different interventions or different implementation might impact the system and either improve it or make it worse. Both of these processes are great ways to engage stakeholders, and you really want to try to get as many different types of perspectives and folks in the room on this, because everybody kind of has a different experience with the pathway. And although the final visual is really important and very useful for planning implementation work, the process of getting to that visual is also really important as well. There are also a number of qualitative and mixed method elicitation techniques that can be used. Design thinking methods, or also called human-centered design. These consist of things like prototyping, mind mapping, stakeholder analysis. This can be very helpful with getting information on what people find desirable, viable, feasible. It's often used a lot when developing mobile health interventions or apps. There's also a set of tools for cultural domain and cultural consensus elicitation and analysis. And this is kind of a little toolbox in and of itself of both qualitative and quantitative approaches. And this helps you understand how people group things in a domain and whether they agree on things that are alike or dissimilar. And so this can be helpful if you want to understand how people think of barriers or facilitators, and whether they kind of see these as being similar barriers or facilitators, or whether they affect different parts of the system. This is also kind of incidentally a useful approach for survey development, instrument development. Qualitative vignettes are hypothetical situations or stories that can be used to elicit narratives from participants about their responses and attitudes to different situations. These can be visual, read aloud to people, videos, different ways of doing vignettes. And then focus group discussions, which are a pretty simple tool that many of us have probably used or encountered at some point in the past. Well, focus groups can be very helpful way to start discussions, to engage with community members, and elicit their insights and start to build trust and relationships, especially if you kind of do multiple focus groups over the course of a project, so that you're kind of building expertise and building kind of relationships with community members. I will say that simply doing one focus group is not really true engagement. It really takes kind of sustainment of these things. I also want to note that there's a misconception that a lot of these approaches to engagement, that they take too long, that it's too hard to collect data, it's too hard to analyze the data, and they're just really not feasible time-wise. And so that's not true. A lot of these approaches have been adapted and can be done in a rigorous way that's also very rapid and allows for kind of rapid cycles of implementation and course correction and kind of multiple iterative cycles of work, of engagement and work. So now I want to have kind of a little bit of a quiz. And I'm going to present a couple of scenarios, and I want you to decide if these represent community engagement or not. So the first scenario I'll read to you is a researcher wants to understand factors influencing maternal and child health in a community hospital where she's never worked before. She decides to conduct 2 focus groups with mothers on their experiences accessing antenatal and postnatal care, and will publish the findings in a scientific journal. So, oh no, I would hope that the scenarios were going to be separate in the poll question.
Sorry. Yeah, if everybody could just answer scenario 1, I'm going to go ahead and relaunch the poll. So just answer scenario 1, and then we can get to scenario 2 once Dr. Brault brings it up.
Thank you. Sorry about that. So do you think that this represents an example of community engaged research or not? All right. Hopefully everybody's had a chance to answer who wants to. So this is not an example. The reason why is you don't have kind of, the researcher is really interested in doing this and kind of the one driving the agenda. And you've got kind of superficial engagement with community members and plans to publish only in a scientific journal. So not really any plans to kind of disseminate more broadly.
Dr. Brault, just to let you know, they had to answer both in order to submit.
Oh, okay.
So I'm just going to relaunch it for the second one as well.
That's fine. Thank you.
Sorry, everybody.
This is the challenge of trying to do things spur of the moment live, but it's okay.
We know for next time.
Okay, so scenario number 2. A researcher has been working on maternal and child health with a community hospital for 2 years. At a community advisory meeting, stakeholders described challenges with maternal mortality and morbidity. They would like to explore causes and solutions. The researcher and the stakeholders partner to design and implement the study, which includes focus group discussions and a quantitative needs assessment. The findings will be published in a scientific journal and also shared at the community advisory meeting. So what do you think? Is this an example of community engagement or not? All right. So hopefully everybody's had a chance to respond. Yes, this is an example of community engagement, and it looks like many of you got 100% on the quiz here. So the reason why this is an example of community engagement, you've got the researcher partnering with community members and plans to disseminate in lots of different formats in ways that will be useful to folks. Okay, so now shifting gears, how do we use these in implementation research? Well, a lot of the things that I described about community engagement are also very similar to implementation science. Both of them are usually carried out by teams and multidisciplinary to begin with. And community engaged approaches are also very team oriented and can really help build collaboration, especially when you have people with kind of disparate roles or disparate expertise. And successful implementation, it ultimately requires coordination across different types of groups, different communities, stakeholders, potentially different organizations. And if stakeholders don't understand or do not agree with the intervention, they may not want to support it. They may not want to support implementation. And then your study is going to be kind of stuck. And stakeholders can offer really important insights into barriers and facilitators of implementation from the very beginning of the study. And so really engaging them at the very beginning as you're planning can really help you avoid some challenges and issues later on down the road. And oftentimes evidence-based interventions, they're developed elsewhere, tested elsewhere. They may need some adaptation before they can be implemented. And understanding what and how to adapt the intervention often requires stakeholder insights. So if you think about kind of the process of implementation research, I know you're all probably a little bit tired of seeing the same process, but I think it's important to see how community engagement can fit into each of these steps. And I'm going to discuss case studies that kind of illustrate how this can happen. So when you're selecting the evidence-based intervention, assessing what's needed and what might work, community engagement can help there. As you try to adapt the EBI to local context, local language, local fit, community engagement can help you with that. In the process of implementation, kind of maintaining those relationships with communities, with implementers is important to making sure that implementation fidelity and feasibility is maintained. And then as you think about scaling up implementation or just sustaining implementation of a practice at a site, you'll want to kind of build the self-efficacy of those who will be implementing to ensure that that can happen. And that also requires engagement and trust. And then throughout the process, it's really helpful to have an advisory board that can kind of, you can do kind of, periodic check-ins with and touch base with them, let them know how things are going, and continue eliciting insights as new challenges or new issues arise. So I'm going to talk about some examples from the literature. So using community engagement to assess needs and identify the evidence-based intervention that's needed to address the problem. Formative research that involves community engagement, that uses some of the tools that we talked about, can help with choosing the relevant EBI for implementation. So this is an example of a project that I worked on in Eswatini, formerly Swaziland. And in this project, we knew that engaging adolescent girls and young women in sexual and reproductive health care, particularly HIV testing and treatment, was a key challenge and a key issue that needed to be tackled. And we used a modified photo voice activity where young women brought in pictures of things that they thought were helpful to prevent HIV, to have better health and well-being. And the picture and quote there is an example from that activity. We also did a lot of mobilization and engagement with community advisory boards and community leadership. And through this process of engagement, we identified that there was a need for better implementation of youth-friendly services at local clinics so that young women would come into the clinics and weren't scared or weren't being stigmatized. And that there was also a need for a different way of reaching young women and communicating with them. And so shifting from kind of a risk-based approach to communication to a gain-framed approach. And through the process of this community engagement and choosing the evidence-based interventions through this community engagement, the Girl Champ program came into being. And the community engagement made the resulting program more effective by emphasizing the needs that young women have, by working through existing community resources and building on existing resources at the clinics that were already there. So also helped with sustainability as well. And the program, at least in part due to this community engagement, the program was very successful, and we saw a significant increase in uptake of HIV testing among adolescent girls and young women. So community engagement to adapt an evidence-based intervention. As I said, you generally need to do some amount of adaptation. An example that I drew on is the Mana Mali digital cognitive behavioral therapy anxiety program in India. And so this was something that they took an in-person CBT intervention that was developed and used in the United States and converted it to app-based, to a mobile app for implementation purposes that could be used with college students in India to address their anxiety. And they used theater testing groups to kind of prototype and help with the design and usability of the app, as well as focus group discussions with university students, with community members, to adapt the content and the language to local needs, local fits. And participants used the program and talked about usability, acceptability, and feasibility so that it was really ready to launch and be implemented. So community engagement during implementation of an evidence-based intervention. Over the course of implementation, community engagement can and should occur through regular check-ins with your advisory board. It's also really good to continue to engage community members and implementers because they're often the ones who are implementing this evidence-based practice. And so it's always good to kind of keep your finger on the pulse of what's going on with them. So the example here is the last 10 kilometers 2020 project in Ethiopia, where the intervention was a mobile app to support health extension workers, community health workers, and their supervisors in the delivery of maternal and child health in Ethiopia, particularly around identifying women in the perinatal period and supporting linkages to care. And they interviewed key stakeholders qualitatively at multiple points. They had a number of focus groups regularly throughout the process of implementation with people at different levels of the system, implementers, and representatives from the Ministry of Health. And this helped them identify and address and course correct some of the implementation barriers and highlight some of what was working well. And this was very helpful when kind of the research study ended and it was time to transition ownership to the health extension workers, to the implementers, because they had been engaging with them in this process all along. Community engagement for dissemination and sustainment. It's important to have plans for maintaining implementer and stakeholder buy-in as the research project ends. And sustaining the evidence-based intervention may require shifting to community or stakeholder-led implementation. The example here is the Peace of Mind program that was implemented in Texas. And this was trying to improve women's attendance, adherence to breast exam, mammography appointments. And the intervention consisted of a telephone appointment reminder and brief counseling to address barriers to keeping the appointment. And throughout, they identified kind of 3 key stakeholder groups at each site where this was implemented. And there was community engagement integrated into all stages of the implementation process, including sustainment through regular check-ins, regular meetings, either as group or one-on-one with people involved in implementation. And so by the end of the project, the stakeholders were supported by the research team to build their efficacy to continue implementation, even once the researchers were no longer there. So I want to provide, there are many excellent examples of community engagement and implementation research done well, but I wanted to provide an example of an instance where this did not work as well and how that led to a failure in the scientific process and kind of, implementation not going so well. So this is an example from the VOICE study. This was a vaginal microbicide trial in South Africa. And this was a follow-up study. VOICE is a follow-up to a Capriza study to look at kind of in real-world settings the efficacy of a vaginal microbicide gel for HIV prevention among women in South Africa. And this was a microbicide gel that was found to be very promising, and there was a lot of excitement, but they wound up stopping the VOICE study early because they found that not only was this gel not helping, it seemed like it could be causing some harm. And there was a kind of, when the study was stopped, there was a lot of shock and a lot of concern. And this, there was a lot of discussion about, why didn't the participants tell us that these were problems? Why didn't we know? And kind of some almost finger pointing and a little bit of blame. But as the data and more follow-up data was collected, as they did kind of community engagement on the back end to figure out what happened, they realized that they didn't adequately engage the community on the front end at the beginning of the study. And this is an editorial that was published in Al Jazeera by an HIV researcher with experience in South Africa, really kind of highlighting the fact that this wasn't the participants' fault. This was really a failure in the research design to not do enough community engagement. And as a result of this study and this problem, a number of organizations changed their guidelines and requirements for HIV research to build in community engagement throughout that process to ensure that these kinds of issues would not happen. So some of the conclusions and takeaway messages for this. If communities aren't invested in the evidence-based program, guideline, intervention, whatever it is, they probably are not going to use it or implement it. And your EBI is only as good as people as it's going to be implemented with fidelity. And as we're seeing kind of from a logistical standpoint, funding agencies and journals are increasingly recognizing the need for community engagement. And in funding proposals for National Institutes of Health, they will often ask reviewers to assess whether community engagement is being done in an appropriate way. And journals are now also asking the authors to comment on how they engaged communities or patients in the research. And as we've talked about, there are lots of different tools and approaches that can be used to engage stakeholders, and matching the tool to your research and question and design is very important. And hopefully by the end of this, I've convinced you that community engagement really is a critical process that has to be embedded within implementation research. And I just want to close with kind of this nice picture from the TB Alliance. Without community, research is not possible. I think that is absolutely correct. And I've got kind of a not exhaustive, but starter list of different online resources that discuss some of the things that I talked about, as well as some primary articles and literature. So when you receive the slides, hopefully you can go back and check out some of these things. As I said, there were too many really wonderful examples to include. So I could have talked forever. So thank you all.